A hospitalized client is diagnosed with scabies. The primary healthcare provider, PHCP, recommended that the client and the client's roommate be treated with lindane. Which finding, if noted on this client's chart, would alert the nurse to notify the PHCP before the treatment with lindane? 1. Client history of diabetes. 2. Client history of hypertension. 3. Client history of seizure disorders. 4. Client history of coronary artery disease. Answer. 3. Client history of seizure disorders. Rationale. Lindane can penetrate intact skin and cause seizures if absorbed in sufficient quantities. A client with a pre-existing seizure disorder is at high risk. Other clients at high risk for seizures include premature infants and children. Lindane should not be used on pediatric clients unless safer medications have failed to control the infection. Options 1, 2, and 4 do not identify contraindications related to the use of this medication. The nurse teaches a client about the effects of diphenhydramine, which has been prescribed as a cough suppressant. The nurse determines that the client needs further instruction if the client makes which statement. 1. I will take the medication on an empty stomach. 2. I won't drink alcohol while taking this medication. 3. I won't do activities that require mental alertness while taking this medication. 4. I will use sugarless gum, candy, or oral rinses to decrease dryness in my mouth. Answer. 1. I will take the medication on an empty stomach. Rationale. Diphenhydramine has several uses, including as an antihistamine, antitussive, antidyskinetic, and sedative hypnotic. Instructions for use include taking with food or milk to decrease gastrointestinal upset and using oral rinses, sugarless gum, or hard candy to minimize dry mouth. Because the medication causes drowsiness, the client should avoid use of alcohol or central nervous system depressants, operating a car, or engaging in other activities requiring mental awareness during use. A client with ovarian cancer is being treated with vincristine. The nurse monitors the client, knowing that which manifestation indicates an adverse effect specific to this medication. 1. Diarrhea. 2. Hair loss. 3. Chest pain. 4. Peripheral neuropathy. Answer. 4. Peripheral neuropathy. Rationale. An adverse effect specific to vincristine is peripheral neuropathy, which occurs in almost every client. Peripheral neuropathy can be manifested as numbness and tingling in the fingers and toes. Depression of the Achilles tendon reflex may be the first clinical sign indicating peripheral neuropathy. Constipation rather than diarrhea is most likely to occur with this medication, although diarrhea may occur occasionally. Hair loss occurs with nearly all antineoplastic medications. Chest pain is unrelated to this medication. Metformin is prescribed for a client with type 2 diabetes mellitus. What is the most common side effect that the nurse should include in the client's teaching plan? 1. Weight gain. 2. Hypoglycemia. 3. Flushing and palpitations. 4. Gastrointestinal disturbances. Answer. 4. Gastrointestinal disturbances. Rationale. The most common side effect of metformin is gastrointestinal disturbances, including decreased appetite, nausea, and diarrhea. These generally subside over time. This medication does not cause weight gain. Clients lose an average of 7 to 8 pounds, 3.2 to 3.6 kilograms, because the medication causes nausea and decreased appetite. Although hypoglycemia can occur, it is not the most common side effect. Flushing and palpitations are not specifically associated with this medication. The nurse is providing instructions to the client who is taking Antacid tablets. How should the nurse instruct the client to take this medication? 1. Chew the tablet thoroughly. 2. Swallow the tablet with water. 3. Place the tablet under the tongue. 4. Place the tablet between the gum and the cheek. Answer. 1. Chew the tablet thoroughly. Rationale. Antacid tablets should be chewed thoroughly and followed by a full glass of water or milk. Options 2, 3, and 4 are incorrect. Aluminum hydroxide is prescribed for a client with chronic kidney disease, CKD. The nurse should instruct the client to take this medication at what time? 1. At bedtime. 2. With meals. 3. On an empty stomach. 4. In the morning on arising. Answer. 2. With meals. Rationale. The client who is receiving aluminum hydroxide should take the medication with meals. The phosphate-binding effect of this medication is most effective when it is taken with food. If tablets are used, they should be chewed well before swallowing. Dantrium sodium has been administered to a client with a spinal cord injury. The nurse determines that the client is experiencing a side or adverse effect of the medication if which is noted. 1. Dizziness. 2. Drowsiness. 3. Abdominal pain. 4. Lightheadedness. Answer. 3. Abdominal pain. Rationale. Dantrium is hepatotoxic. The nurse observes for indications of liver dysfunction, which include jaundice, abdominal pain, and malaise. The nurse notifies the primary healthcare provider if these occur. The signs and symptoms in the remaining options are expected side effects due to the central nervous sys. A client has been administered cyclobenzaprine for the management of muscle spasms in the cervical spine. The client is experiencing drowsiness, dizziness, and dry mouth. How should the nurse interpret these findings? 1. Represent an allergic reaction to the medication. 2. Are related to the problem with the cervical spine. 3. Are the most common side effects of this medication. 4. Are dose related, so the client should cut the medication dose in half. Answer. 3. Are the most common side effects of this medication. Rationale. Drowsiness, dizziness, and dry mouth are the most common side effects of cyclobenzaprine. And these side effects usually diminish with continued therapy. This medication is a centrally acting skeletal muscle relaxant used in the management of muscle spasm that accompanies a variety of conditions. The remaining options are incorrect. A client is admitted to the hospital with a diagnosis of myocardial infarction, MI. The client is started on alteplase therapy. The nurse determines that teaching has been effective when the client's significant other states that the purpose of the medication is to perform which action? 1. Thin the blood. 2. Slow the clotting of the blood. 3. Dissolve any clots in the coronary arteries. 4. Prevent further clots from forming in the coronary arteries. Answer. 3. Dissolve any clots in the coronary arteries. Rationale. Alteplase converts plasminogen in the blood to plasmin. Plasmin is an enzyme that digests or dissolves fibrin clots wherever they exist. Heparin sodium and warfarin sodium thin the blood, slow clotting, and prevent further clots from forming. Somatropin is administered to a client with growth failure. A nurse monitors the client, knowing that which is the expected therapeutic effect of this medication. 1. Promote weight gain. 2. Increase bone density. 3. Stimulate linear growth. 4. Decrease the mobilization of fats. Answer. 3. Stimulate linear growth. Rationale. Somatropin is a growth stimulator used in the long-term treatment of growth failure resulting from endogenous growth hormone deficiency. Somatropin stimulates linear growth, increases the number and size of muscle cells, and increases red cell mass. Somatropin affects carbohydrate metabolism by antagonizing the action of insulin, increases mobilization of fats, and increases cellular protein synthesis. The remaining options are not actions of this medication. A client has been receiving Foscarnet as part of therapy for the treatment of cytomegalovirus, CMV, retinitis and acquired immunodeficiency syndrome, AIDS. The home care nurse should periodically review results of which laboratory blood test to assess for adverse effects to this medication. 1. CD4 plus cell count 2. Lymphocyte count 3, albumin concentration 4, creatinine concentration. Answer. 4. Creatinine concentration rationale. Acquired immunodeficiency syndrome is a viral disease caused by the human immunodeficiency virus, HIV, which destroys T cells, thereby increasing susceptibility to infection and malignancy. Foscarnet is an antiviral medication. Because Foscarnet is toxic to the kidneys, serum creatinine is monitored before therapy, 2 or 3 times per week during induction therapy, and at least weekly during maintenance therapy. It also may cause decreased levels of calcium, magnesium, phosphorus, and potassium. So these are monitored with the same frequency. The blood tests in the remaining options are not associated with adverse effects of the medication. Etanercept is prescribed for a client with rheumatoid arthritis. The nurse should monitor the client for which side adverse effect of the medication following administration. 1. Dyspnea 2. Headache 3. Dizziness 4. Abdominal discomfort. Answer. 1. Dyspnea rationale. Etanercept is an anti-arthritic medication that is administered via the subcutaneous route. Side adverse effects include heart failure, noted by manifestations of dyspnea and congested lung sounds on auscultation, hypertension or hypotension, pancreatitis, or gastrointestinal hemorrhage. Headache, dizziness, and abdominal discomfort are not side adverse effects of the medication. A nurse is caring for a client with a diagnosis of hyperthyroidism. Laboratory studies are performed, and the serum calcium level is 12.0 mg per deciliter, 3 mmol/L. Which medication should the nurse anticipate to be prescribed for the client? 1. Calcitonin 2. Calcium chloride 3, calcium gluconate 4, large doses of vitamin D. Answer. 1. Calcitonin rationale. The normal serum calcium level is 9 to 10.5 mg per deciliter, 2.25 to 2.75 mmol/L. This client is experiencing hypercalcemia. Calcitonin, a thyroid hormone, decreases the plasma calcium level by increasing the incorporation of calcium into the bones, thus keeping it out of the serum. Calcium chloride and calcium gluconate are medications used for the treatment of tetany that occurs from acute hypocalcemia. In hypercalcemia, large doses of vitamin D need to be avoided. A home healthcare nurse is visiting an older client at home. Furosemide is prescribed for the client, and the nurse teaches the client about the medication. Which statement, if made by the client, indicates the need for further teaching? 1. I will sit up slowly before standing each morning. 2. I will take my medication every morning with breakfast. 3. I need to drink lots of coffee and tea to keep myself healthy. 4. I will call my primary healthcare provider if my ankles swell or my rings get tight. Answer. 3. I need to drink lots of coffee and tea to keep myself healthy. Rationale. Tea and coffee are stimulants and mild diuretics. These are a poor choice for hydration. Sitting up slowly prevents postural hypotension. Taking the medication at the same time each day improves compliance. Because furosemide is a diuretic, the morning is the best time to take the medication so as not to interrupt sleep. Notification of the primary healthcare provider is appropriate if edema is noticed in the hands, feet, or face, or if the client is short of breath. The preoperative medication sheet identifies that cyclobenzaprine is prescribed for a client before cataract surgery. The client asks the nurse what the medication is for, and the nurse provides education. Which statement by the client indicates that teaching has been effective? 1. It lubricates the eye. 2. It makes my pupils smaller. 3. It paralyzes the muscles in my eye. 4. It causes my vessels to become smaller. Answer. 3. It paralyzes the muscles in my eye. Rationale. Cyclobenzaprine is used for preoperative mydriasis. It is a rapid-acting mydriatic and cycloplegic medication. Cycloplegics are medications that paralyze the ciliary muscle, and mydriatics are medications that dilate the pupil. Cyclobenzaprine becomes effective in 25 to 75 minutes, and the effects last for 6 to 24 hours. The statements in the remaining options are not actions of this medication. A client with tuberculosis is being started on anti-tuberculosis therapy with isoniazid. Before giving the client the first dose, the nurse should ensure that which baseline study has been completed. 1. Electrolyte levels 2, coagulation times 3, liver enzyme levels 4, serum creatinine level. Answer. 3. Liver enzyme levels. Rationale. Isoniazid therapy can cause an elevation of hepatic enzyme levels and hepatitis. Therefore, liver enzyme levels are monitored when therapy is initiated and during the first 3 months of therapy. They may be monitored longer in the client who is older than 50 years or abuses alcohol. The laboratory tests in options 1, 2, and 4 are not necessary. Following kidney transplantation, cyclosporin is prescribed for a client. Which laboratory result would indicate an adverse effect from the use of this medication? 1. Hemoglobin level of 14.0 grams per deciliter, 140 mmol, L2. Creatinine level of 0.6 mg per deciliter, 53 mmol, L3. Blood urea nitrogen level of 25 mg per deciliter, 8.8 mmol, L4. Fasting blood glucose level of 99 mg per deciliter, 5.5 mmol, L. Answer. 3. Blood urea nitrogen level of 25 mg per deciliter, 8.8 mmol, L. Rationale. Cyclosporin is an immunosuppressant. Nephrotoxicity can occur from the use of cyclosporin. Nephrotoxicity is evaluated by monitoring for elevated blood urea nitrogen and serum creatinine levels. The normal blood urea nitrogen level is 10 to 20 mg per deciliter, 3.6 to 7.1 mmol, L. The normal creatinine level for a male is 0.6 to 1.2 mg per deciliter, 53 to 106 mmol, L, and for a female is 0.5 to 1.1 mg per deciliter, 44 to 97 mmol, L. Cyclosporin can lower complete blood cell count levels. A normal hemoglobin is 14 to 18 grams per deciliter, 140 to 180 mmol, L, for a male and 12 to 16 grams per deciliter, 120 to 160 mmol, L, for a female. A normal hemoglobin is not an adverse effect. Cyclosporin does affect the glucose level. The normal fasting glucose is 70 to 99 milligrams per deciliter, 3.9 to 5.5 mmol/L. 18. The primary healthcare provider has prescribed clonidine for a client with hypertension. The nurse should inform the client that which is a side effect of this medication. 1. Restlessness. 2. Constipation. 3. Hypertension. 4. Increased salivation. Answer. 2. Constipation rationale. Clonidine is an antihypertensive medication. Side effects of clonidine include dry mouth, drowsiness, constipation, and hypotension. Therefore, symptoms in the remaining options are incorrect. A client with a respiratory tract infection is receiving intravenous tobramycin sulfate. The nurse should assess for which adverse effect of this medication. 1. Nausea. 2. Vertigo. 3. Vomiting. 4. Hypotension. Answer. 2. Vertigo rationale. Tobramycin sulfate is an aminoglycoside. Ringing in the ears and vertigo are symptoms of ototoxicity that may indicate dysfunction of the 8th cranial nerve. This is a frequent adverse effect of therapy with the use of aminoglycosides and could result in permanent hearing loss. In clients with these symptoms, the nurse should withhold the dose of the medication and notify the primary healthcare provider. Nausea, vomiting, and hypotension are rare side effects of the medication. The nurse should monitor the client prescribed thioridazine hydrochloride carefully for which adverse effect. 1. Weight gain. 2. Photosensitivity. 3. Cardiac dysrhythmias. 4. Extrapyramidal movements. Answer. 3. Cardiac dysrhythmias rationale. Thioridazine hydrochloride is an antipsychotic medication that may be prescribed for the schizophrenic client when other medications have failed to manage the symptoms. Cardiac dysrhythmias are an adverse effect of thioridazine. Weight gain and extrapyramidal movements are not associated with this medication. Photosensitivity is a rare side effect. The nurse is administering a dose of purbuterol to a client. The nurse should monitor for which side or adverse effect of this medication. 1. Drowsiness. 2. Hypokalemia. 3. Hyperglycemia. 4. Increased pulse. Answer. 4. Increased pulse rationale. Purbuterol is an adrenergic bronchodilator. Side and adverse effects include tachycardia, hypertension, chest pain, dysrhythmias, nervousness, restlessness, and headache. The nurse monitors for these effects during therapy. The other options are not side and adverse effects of this medication. A client must begin medication therapy with mycophenolate mofetil to prevent organ rejection following renal transplantation. The nurse should provide which important teaching point to the client? 1. Take the dose following meals. 2. Open the capsule and mix with food before use. 3. Take the medication with an aluminum-based antacid. 4. Notify the primary healthcare provider, PHCP, if a fever develops. Answer. 4. Notify the primary healthcare provider, PHCP, if a fever develops. Rationale. Mycophenolate mofetil is an immunosuppressant. The client should contact the PHCP if unusual bleeding, bruising, sore throat, mouth sores, abdominal pain, or fever occurs. Antacids containing magnesium and aluminum may decrease the absorption of the medication and should not be taken with it. The medication is given in combination with corticosteroids and cyclosporin. Mycophenolate mofetil may be administered on an empty stomach. The capsules should not be opened or crushed. A client with a peptic ulcer is diagnosed with a Helicobacter pylori infection. The nurse is teaching the client about the medications prescribed, including clarithromycin, esomeprazole, and amoxicillin. Which statement by the client indicates the best understanding of the medication regimen? 1. My ulcer will heal because these medications will kill the bacteria. 2. These medications are only taken when I have pain from my ulcer. 3. The medications will kill the bacteria and stop the acid production. 4. These medications will coat the ulcer and decrease the acid production in my stomach. Answer. 3. The medications will kill the bacteria and stop the acid production. Rationale. Triple therapy for H. pylori infection usually includes 2 antibacterial medications and a proton pump inhibitor. Clarithromycin and amoxicillin are antibacterials. Esomeprazole is a proton pump inhibitor. These medications will kill the bacteria and decrease acid production. The nurse has the following prescription for a postcraniotomy client. Dexamethasone 4 mg by the intravenous, IV, route now. How does the nurse administer the medication? 1. IV pushover 1 minute 2. IV pushover 4 minutes 3. IV piggyback in 100 ml of normal saline over 10 minutes 4. IV piggyback in 100 ml of normal saline over 30 minutes. Answer. 1. IV pushover 1 minute. Rationale. Dexamethasone is an adrenocorticosteroid administered after craniotomy to control cerebral edema. It is given by IV push, and single doses are administered over 1 minute. Dexamethasone IV doses are changed to the oral route after 24 to 72 hours and are tapered until discontinued. In addition, IV fluids are administered cautiously after craniotomy to prevent increased cerebral edema. Cromolyn sodium is prescribed for the client with allergic asthma. What goal does the nurse expect to achieve by administration of this medication? 1. Dilation of the bronchi. 2. Increase in the number of eosinophils. 3. Promotion of the migration of eosinophils into the inflammatory site. 4. Inhibition of the release of mediators from mast cells after exposure to an antigen. Answer. 4. Inhibition of the release of mediators from mast cells after exposure to an antigen. Rationale. Cromolyn sodium is an anti-asthmatic, anti-allergic, and mast cell stabilizer that inhibits the release of mediators from mast cells after exposure to an antigen. It can also interrupt the migration of eosinophils into the inflammatory site and decrease the number of eosinophils. These actions decrease airway hyperresponsiveness in some clients with asthma. It has no bronchodilating action. Minoxidil is prescribed for a client to treat hair loss. The client asks the nurse if the hair will continue to grow when the medication is stopped. What is the appropriate nursing response? 1. The hair will continue to grow. 2. Newly gained hair is lost in 3 to 4 months. 3. It depends on how long you have been taking the medication. 4. I'm not sure. You need to ask your primary healthcare provider. Answer. 2. Newly gained hair is lost in 3 to 4 months. Rationale. Hair regrowth with the use of minoxidil is most likely to occur when baldness has developed recently and has been limited to a small area. Benefits of the medication take several months. On discontinuation of the medication, newly gained hair is lost in 3 to 4 months, and the natural progression of hair loss resumes. Options 1 and 3 are incorrect. Option 3 places the client's question on hold and is inappropriate. When teaching the client with adrenal insufficiency about cortisone, the nurse should include which items? Select all that apply. 1. Increase intake of sodium. 2. Take the medication with food. 3. Increase intake of potassium-rich foods. 4. Stay away from people with active infections. 5. Discontinue the medication when symptoms subside. 6. Notify the primary healthcare provider if illness occurs or surgery is anticipated. Answer. 2. Take the medication with food. 3. Increase intake of potassium-rich foods. 4. Stay away from people with active infections. 6. Notify the primary healthcare provider if illness occurs or surgery is anticipated. Rationale. Glucocorticoids should not be abruptly discontinued because acute adrenal insufficiency could occur. Because glucocorticoids cause sodium and water to be retained while causing loss of potassium, the client should limit sodium intake and increase potassium intake. These medications can increase the risk of infection. Therefore, the client should avoid contact with clients who are ill. Taking the medication with food helps prevent stomach upset. Individuals may need an increase in dosage during illness or times of stress, surgery,